Cammie was 4 when she was diagnosed with her brain tumors. She loves music and dancing. She was always dancing and singing. The ringleader of any group of children she was around, she was always in charge.
One evening 2 years ago,
we weren't sure if she was having
a seizure
or a stroke, or, we didn't know what was going on. So we called 911.
It was definitely an all hands on deck situation.
She'd just turned 4, and so she really didn't know what was going on. And so we're like, if we could just go ahead and do the MRI now, that would be great.
The message essentially was, we don't know what this is.
They had never seen anything like that before. 3 spots that had lit up. They were 3 separate tumors. At this point, we weren't sure it was cancerous. We met with geneticists, infectious disease, neurosurgery, neurology. We couldn't even keep up with who came into the room.
A new set of results would come back. Well, you know how we told you it was as bad as it can be? Well, that's before we knew this. Now it's really as bad as it could be. And that truly happened for, 2 weeks.
Her diagnosis was high-grade glioma.
Cammie had 3 to 6 months to live. Our head oncologist also told us that most loving families at this point would just go home and enjoy the time that they had.
And he kept saying that whatever you choose to do is the right choice.
So we traveled all over the country to different children's hospitals to seek advice from the best minds.
Doctors coming in and out, just answering questions, just brainstorming, what can we do? What are next steps?
The only place that really had any answer and option was in Florida. It was not what we hoped for. It started off with a brain surgery to debulk her tumors as best they could. Then it was going to be chemotherapy for multiple cycles, then radiation for 6 weeks. And then they were going to inject her stem cells for a total of 8 months. And they gave us a 10% chance.
And we were excited about that.
Thrilled.
It was the first time that someone had given us something that we could do to give our daughter a chance.
72 hours before that surgery, a test came back that showed that Camden had a very, very particular mutation in her tumors. And that was a miracle. It allowed some more information to get to researchers. And one of those researchers was Dr. Giles Robinson at St. Jude Children's Research Hospital. And he said for the first time in human history, they thought that they might have a medicine that could help Cammie with exactly what she had.
Her genetic testing showed that she had a ROS1 fusion, which entrectinib targets ROS1 fusions. And this meant that we would not be able to do the Florida clinical trial. It had to be a either or.
Luckily, the decision was very, very quick, especially once we heard what the treatment plan was. She would take 2 pills per day as her treatment. So we were there the next day.
I'll never forget when the research nurse, Tracy, came in and handed me a 3-year roadmap. And it had dates of dosing, blood tests, and MRIs. And I remember just looking at her and saying, 3 years? Like,
she must have given us something wrong.
Oh my gosh. It was amazing. It made me tear up just thinking about it. We were coming up on 3 months when the first MRI happened. 3 of her 5 tumors were completely gone.
Cammie's MRI images were all over these monitors. Dr. Robinson was pretty surprised. He used the word miracle.
She's been on the medication for 2 years. Those 2 other tumors, they've just stayed consistent for 2 years.
There's 2 side effects. One is weight gain, and the other one is brittle bones. We knew about Cammie's because she had bilateral femur fractures within just a handful of months. Cammie has been incredible throughout this entire journey. She is a fighter. There are countless people with stories just like ours. We would ask and be very grateful for the support and advocacy and funding going forward. This family has directly benefited from research, from funding, clinical trials. We have seen every kind of person, and they all just want hope. Some way
path,
to keep going.
A path to help their child.